In 2022, the state of Iowa reported 237 deaths involving opioids. Health officials are looking for ways to prevent these tragedies, and it could happen with some new technology. The key could be artificial intelligence. The author of a new book says while traditional measures like border control and treatment are crucial, it's not enough to take on this crisis. And the use of AI to fill in those gaps is promising. Michael Vasquez joins us now. He is the author of The Untold Story of the Opioid Crisis in American Healthcare. Thank you so much for being with us.
Hi, Erin. Thanks for having me.
I was so intrigued when you reached out to me on LinkedIn and, immediately started doing some Google research. You have quite an extensive background in healthcare.
It has been a long, fun journey. It has.
Yeah, so you bring a lot of knowledge to the table. Explain to me how this became of interest to you, the issue of opioids and addiction.
It was really a mix during my career. Early on, I started a company with John Papajohn that built the first AI healthcare system that had electronic medical records as its product, and it was the first company to go public on NASDAQ. And so that really got me involved on the AI side of healthcare. And then that progressed. I worked on a few other companies with John, and then a family member got involved with opioids, and so we decided to help a little. We've been blessed with some time and some resources, and from that then, we thought we'd just get involved on a small scale. Fast forward 13 years, and we'd built a very large opioid treatment program and one of the leading opioid detox centers in the country.
Okay, you and I connected on LinkedIn, and you have a really slick, informative video that's posted right there at the top of your LinkedIn profile that really boils down how this works. So just give people sort of that Cliff Notes version, if you will, of what this technology does and how it works to prevent people becoming addicted.
Yeah, it's really designed as a prevention tool just so it's not mixed up with treatment. But what people don't realize is 100% of the people who come through an opioid detox center suffer withdrawal. Withdrawal is the body screaming out that it needs an opioid. And the way it does that is it makes you sick. I'm going to make you nauseated. I'm not going to let you sleep until you give me an opioid. What people don't realize is, though, similar to that, when I'm out in the public, the person next to your cubicle, your next door neighbor, if they're prescribed an opioid, what happens is at the same time, the body starts to heal. And because it heals, you become very inconsistent in how you take your prescription, unknowingly throwing yourself into withdrawal. Different than what it was like in the detox center, but the same symptoms. So what we did was we looked for those inside of a medical record and found by building AI tools that could spider through the medical records, find those indicators, we could identify patients and doctors who are struggling with treating opioid patients in their community.
Okay, I think people hear this initially. I know I did. I was like, I'm a little creeped out by this. Like, are you going through my medical records and, people know, what I'm diagnosed with, what sorts of medications I'm on, but it's actually the back end of it in terms of physicians who are prescribing. Explain that to people.
Yeah, the interesting part is that because we're looking for these medical patterns, we're not looking for who you are. So for example, we have 1,700 clients using the software, but we have a large client in Central Florida school district. We've been installed there 3 years. We've reduced opioid withdrawal symptoms in the school district 70%.
Wow.
And the teachers still don't know we're installed. We've never talked to a teacher. We've never identified a teacher. We've been able to do this completely because of AI, behind the scenes, working with the doctors to improve how they deliver care, not how they practice.
Interesting. You have written a book about this. We have a photo of the book, and I'm sure people can find that via your LinkedIn profile as well. So just tell us a little bit more about this.
I decided to really write a story because we found as we've gone across the country and talked to people, nobody was really aware of this, that these indicators are hidden inside of a medical record, and everybody assumes that this is being taken care of. And as I've talked to clients, we found that nothing is doing what we're talking about. These indicators we've discovered have not been able to be found until today. And because of that, it's typically a 5-month period until the patients can be found with the addiction already, as opposed to being able to prevent them having to go through this drastic experience in their life.
Okay, Mike, thank you so much for being with us. This is fascinating stuff on all fronts and very, very promising.
Thank you. Thanks for having me.
We appreciate your time.